I want to talk about medical gaslighting. I think because you're a previous journalist, you might have some context for how common it is for weird fucky shit to happen in different sort of types of professional environments. But essentially, I had an accident, two ribs broke apart in such a way that I think anyone looking at it would have assumed that you would need a surgery to fix that. And instead, what I'm told by the medical establishment is that ribs heal themselves, even though obviously this is an edge case where that is not true. And I was left to essentially suffer, and the ribs healed very badly. And yet, what happened was I described the way the ribs healed badly to a doctor. Actually, I guess it was only one doctor, but literally this doctor told me to my face, don't worry about it, give it more time, ribs heal themselves. And this is the same phrasing and terminology I think that they're taught in medical school to use. Ribs heal themselves. They're told not to worry about it. When a patient has broken ribs, they're told not to address it. And then, so I suffered for a whole ass month. The ribs did not come together for a month. So free floating ribs, and I actually had a bunch of other fractured ribs apparently. They told me I had 8 fractured ribs, but I don't give a fuck about the fractured ribs. I get the ones that were really bothering me the most and had so much pain and suffering around were the two that were free floating, would not reconnect. Anyway, so I went to the doctor and I told her how they healed badly, and I was like, dude, this is not acceptable. I think I need a surgery to get them fixed. And she was like, we don't do that, but if you want, we can do an X-ray. And the tone with which she said it was essentially to make you feel better. And I was like, yes, please do an X-ray. And the next day she called me back and she's like, I've already put you in for surgery, right? So that was weird. But also just like the fact that I was discharged from the hospital with 2 completely broken ribs, and the angle at which these ribs are broken is such that it suggests they will not heal end to end because there's too much leverage. So they will have to heal not end to end. They'll have to slip past each other a little bit and then heal, which will permanently leave you with less breathing volume and also give you 2 sharp ends of the ribs sticking out somewhere. And it's just like I think anyone with or without a medical degree could see that this is a problem where broken bones need surgery, and yet the doctors are explicitly trained not to do anything. And then I just recently saw the surgeon about the same issue, and I received a lot of the same exact kind of medical gaslighting. And so this is how the conversation with my surgeon went. Was first off, he says, "Oh, well, your bones seem to be healing," which is really weird because to me, they are not healed. To me, they healed very badly. If I had a leg that was broken and then healed all fucking crooked because there wasn't a surgical intervention, I would say that's not healed, doctor. That's fucking, it's unhealed. It's the opposite of healed. It's healed in such a way that it's going to leave me with permanent problems for the rest of my life. Why are you using the word healed? Just because bones can reattach doesn't mean they reattach in the correct orientation. And but he's using this word, oh, so it looks like things are doing well, and it's just really priming me to accept less from the situation, if that makes sense. And then I'm asking for the surgery that I want, which is that I want the bones to be cut apart and put back together end to end. And he's using words like, oh, that's impossible. It can't be done. And I'm not kidding. He literally used the word impossible at first. He used the word, it's impossible, can't do that. And then I asked him why. And he was like, oh, it's just like, I've never done it that way. That's what he said. And the more I look into it, the more I'm starting to realize that the doctor is literally like, he's pushing me to try and accept a surgery and also an eventuality that is worse for me because it's easier for him. I don't think it's going to make him any less money if he does the surgery the proper way and fixes it for me. It's just going to be a slightly easier surgery for him. And also, so he's pushing me to accept a worse outcome. And what he said was that we can cut off the sharp points of the bone so they don't stab into your muscle anymore. And I was like, that actually sounds like it's a minimum viable surgery. I would be happy with that. But I was thinking about it afterwards and I was like, dude, when I came in, he's literally using all this language to prime me to accept a lesser thing. And so I pushed back and I wrote them a message and I was like, no, I would like you to cut them apart and put them back together end to end. And also use it. They said some other stuff. He was saying, and if you do it that way, what they said was, if you cut them apart, put them back together end to end, then you need to use a metal plate. And what happens when you do that is that later on you need a second surgery to remove the metal plate. And as if that's something that I wouldn't want and wouldn't accept. And I was just like, dude, I would totally accept a second surgery to remove the metal plate if it meant that I can breathe fully and also not have pain for the rest of my life, which I expect to live for a long time. I'm just thinking about it, it's just really weird. These doctors are all priming me to accept a really negative eventuality for me because it's better for them and also because it's better for the medical system to not do a surgery if you're willing to accept living with a permanent injury. And so they just prime you to live with a permanent injury. And I'm just like thinking like this feels like a really obvious. I've met other people for whom there is also medical gaslighting. I met a girl the other day who was like, the doctor was treating her, she had a knee injury and she needed like a knee surgery. The doctor was treating her injury. It wasn't real. And just like a lot of the similar stuff. And I'm just like, how often is it the case that doctors are trained to infer and imply that your problem isn't that severe so that they don't have to do anything about it? I think that this is really common practice. I think they're actually taught to do this in medical school because of the way they all did it in the exact same way and also used the same language, the same terminology. And it's just like, and also just, it didn't take very much effort though for them to do an about face and be like, oh, we can do that surgery for you. I pushed back one time and they're like, okay, we can do it. And, but it was just like, until I pushed, there's this weird problem where I don't actually know what's possible. I'm depending on the doctor to tell me what's possible. And so I'm doing a lot of work to read between the lines and realize that what the doctor has told me is not all the truth. The doctor is just hoping that I'm not going to look into it, hoping that I'm not going to stand up for myself and ask for a full treatment. Because, but it's like, I don't even think it's the doctor's fault. The doctor's been trained to teach their patient that the full treatment isn't possible, to use language and insinuations. And what's crazy about it is that it's full on gaslighting. They have the entire weight of the medical establishment. There's a lot of things about my body that the doctor knows that I don't know. So I'm coming to the doctor for advice, but the doctor is not an impartial technician giving me advice. The doctor is like, it's like the auto mechanic. When you go to the auto mechanic to get advice about how to fix your car, you can't really trust the auto mechanic because the auto mechanic is going to suggest that you do way more stuff than necessary. A lot of people have known about this problem. It's the same problem in reverse though with the medical establishment, is that depending on the problem, you might get advice to do more than necessary to fix your problem because it's better for the doctor, or you might get advice to do less than necessary to fix the problem because it's better for the doctor. And it's some serious bullshit because my insurance fully covers any kind of surgery. So it's going to be better for me to do fewer surgeries. It's definitely not better. I'm not financially on the hook at all for these surgeries. So I want the best surgery possible. The doctor is just pushing me in a lot of different ways to accept a worse outcome. And it's really weird. I don't know. Feels like an opportunity for some investigative journalism.